For those of you that don't know me, I'm the president of the Sacramento Central Labor Council. I'm also the political director for UFCW 8. What is HEART? It is the Health Exchange Advocacy and Responsibility Team. We're an alliance of California organizations representing millions of Californians from very diverse backgrounds. Our partners include businesses, labor, patients, healthcare providers, payers, insurers, and political leaders. We're looking to create accessibility, efficiency, utilization, positive outcomes, transparency and value, team-based coordinated care, and competition.
The first question in the survey was a question where we just introduced the idea of the personal health team approach to care to voters. We read them a summary of it. We tried to be just descriptive about it. And what we see is that there's initially a very high level of voter interest in the concept of making available health plan options that offer a physician-led personal health team approach to care. 72% of voters said they would be interested, 32% of whom said they'd be very interested. But what's more significant, and I think the most significant finding from the subgroup analysis, is that the population subgroups that are targeted for coverage expansion through the new health law are actually the populations that seem to be the most interested in the personal health team approach. You can see the younger populations are more supportive or more interested than the older. Ethnic populations more interested than the white non-Hispanics, and the non-insured more interested than the insured, singles more interested than the married. So the target audience for coverage expansion is very interested in these kinds of plans. We then also asked voters how important it is to require insurance companies to include health plans with physician-led personal health teams among their insurance offerings. 80% of California voters felt it's important, with 33% saying it was extremely important. We then asked voters, gave voters two different statements, and we asked them which they felt should be a higher priority for the California Health Insurance Exchange when it's being designed and implemented. The one, and these are the two statements on the left, giving a higher priority to expanding coverage to the uninsured and providing subsidies to those who need help paying for it, and then also give higher priority to changing the way health care is delivered so costs can be contained and care quality improved for all Californians. Now, when we offered that, we did offer them the option of both, and most voters chose that option. A 59% majority thought both of those should be the priorities of the health insurance exchange as we move forward. But it's interesting that among the voters who felt one was more important than the other, more voters give a higher priority to changing the way health care is delivered rather than just expanding its coverage. So this is a unique opportunity for the exchange as we move forward. Voters, I think, would be much more on board with it, much more interested in it if it was a broader in scope and rather than just being limited to expanding coverage. And finally, our last question had to do with its political impact. How important or how likely would it be for you to support candidates who stood behind this particular approach to care, that is, including in the exchange design the improving the care delivery and to contain costs and improve the quality for all? And 71% of voters said this would make them more likely to support such candidates running here in California. So, what is it in the end? In the end, there's very high voter interest in health plans offering personal health team approach to care. And the greatest interest are among the subgroups targeted for coverage expansion. These are the young voters, the ethnic populations, and singles. Voters like the specific characteristics of the personal health team approach to care, and majorities say that it would make them more likely to buy these kinds of plans. And again, the subgroups most likely to be saying this are the young ethnic populations who are targeted for expansion.
It is no coincidence that we're here gathered on the anniversary of the ACA week. If we're fulfilling the goals of that promise, then we have to make the exchange work in a way that is affordable for all, has the quality that the public deserves, and the transparency. So behind me here are various groups, organizations who believe in that, but have different emphasis on different parts of what I've just described to you. So I'm going to ask them to come up one at a time and tell a little bit about their particular perspective on how we make the exchange component of the ACA work for all Californians.
We know as we work out in our communities and we know our patients are very frustrated by the system as it exists right now. There is waste, there is confusion, there is fragmentation. The system is very oriented towards taking care of acute, urgent problems, but is not designed at all to take care of chronic diseases and not prepared to really focus on prevention, which we believe is very, very important.
What we need to do is reorient the way we look at taking care of patients so that we take care of them on an ongoing basis. From the policy end, we know that the sickest 10% spend 60% of the healthcare dollar. And so we're looking at how healthcare costs are rising. There's an opportunity to figure out how do we take better care of those patients. And we have an opportunity with the exchange to try to reorient, refocus the way we're paying for healthcare, the way we're going to be delivering healthcare so that we can change that cost curve, be sure people have better quality of life, and get better care.
So instead of having the fragmented care that we currently have, osteopathic physicians believe that the patient really deserves to have a physician-led team, a team-based approach where the physician is, like we've talked about, having a quarterback of the team. The physician is the quarterback, and the physician is the one that leads the team, but can't do the complete work without that team surrounding him and supporting him and pushing the ball down the field and getting across the goal line.
What Heart is doing today and the team-based care is essential to making the exchange work and to getting care to all these uninsured in California. And Blue Shield is very proud to be a part of that, and we look forward to providing the type of care that Heart is talking about here today. Thank you.
What we do is we provide members with information and support when they have chronic conditions and even those that are even well to help them navigate through the healthcare system. We know with information that members make better decisions and choices, and by supporting those and being member advocates and supporting the initiative of the primary care physician, we can keep members engaged in their health care.
I've survived cancer through having 2 liver transplants, and through the existing system, I can say it's been an enormous struggle under the current conditions. I have survived because I have insisted that a team effort be made and that my providers communicated with one another and addressed the conditions I have.
Arthritis is the #1 cause of physical disability, costs the country $128 billion a year in healthcare costs and worker-related expenses. The Heart Exchange to us is the most important thing because it's offering the opportunity to have reimbursements for evidence-based programs and services, which is important to the people with arthritis. 50% of people with arthritis also tell us that they have some form of heart disease, cancer, or diabetes. Joint pain is one of the problems with arthritis, and so we need to see that exercise is also the key in management of these chronic diseases.
Such an honor to be here today. Say we have been one of the inaugural members of Heart as it came together, which is a profound accomplishment to get such a diverse group together to work on issues that we may not have the same ideas about, but came to the consensus of what needed to be done. And so I applaud Heart and the work of all of our fellow groups that have come together to do that. The Chronic Care Coalition has over 30 different chronic disease and conditions groups, representing over 16 million people in the state of California. So it's really important to us as this exchange comes together that it's done smartly, and we think we've given the roadmap on how to make that happen. Thank you.